A coronavirus model used by the White House now projects more than 200,000 Americans could die of COVID-19 by October 1st. That's up more than 30,000 since last week. This morning, the official U.S. death toll exceeds 116,000 and is still growing by several hundred per day. Manuel Bojorquez is in Miami. Manuel, Florida is one of several states where infections are on the rise. What's the government saying about that?
Well, Anthony, on a call with the nation's governors Monday, Vice President Mike Pence urged state leaders to attribute the spike in new cases to, quote, the magnitude of the increase in testing. But without providing clear evidence, that's the only explanation. Other key metrics like hospitalizations are also on the rise in several states. Some leaders here in Miami say they are not taking any chances.
Now is not a time to let your guard down.
Miami Mayor Francis Suarez put the next phase of his city's reopening on hold.
We are seeing an uptick, particularly in the age demographic 18 to 35, and particularly after Memorial Day weekend.
Statewide, about 12,000 Floridians have tested positive over the last 7 days.
Most likely we're going to start to see an increase in the hospitals.
June Ellis works for one of the state's largest public health systems.
What is the situation like at Jackson Health right now?
We have started to see an increase again in our COVID positive patients.
Since June 1st, hospitalizations have risen in at least 11 states, including Texas, which reported more than 2,300 hospitalizations, a record high for the 7th time in 8 days. And 20 states reported increases in their average new COVID-19 cases compared to 2 weeks ago.
So many people.
At the White House, President Trump attributed the rise in cases to an increase in testing.
That's probably the downside of having good testing, is you find a lot of cases that other countries who don't even test don't have.
But in several states, data show that's not entirely true, according to Professor Wade Fagan-Olmschneider, a computer scientist at the University of Illinois.
The data comes directly from Johns Hopkins, and it doesn't do any projection at all. Even though we're seeing the same or sometimes even more testing, the number of positive cases we're seeing in those regions is actually increasing at a rate far exceeding the number of tests increasing.
Also on Monday, the FDA rescinded its emergency authorization for the use of the drug hydroxychloroquine to treat COVID-19. The president criticized that decision. It's a drug that he had promoted as a possible treatment for the virus and actually taken himself. The FDA said new information showed the drug was unlikely to be effective. Tony?
Yeah, some big developments there on multiple fronts. Manny, thank you very much.